Good evening, everyone. It's my pleasure to be with you tonight, and I'm deeply honored to be your keynote speaker for this evening's 2020 Excellence in Nursing Awards ceremony. I'd like to express my appreciation and gratitude to New Hampshire Magazine and the New Hampshire Nurses Association for taking the leadership to formally recognize the exceptionally high caliber of nursing professionals in our state. I've been in practice as a registered nurse in New Hampshire for 40 years this year, and in this time, I've had the opportunity to work alongside hundreds of nursing colleagues from all over our state. I know well the dedication, the commitment, the knowledge, and the downright grit of New Hampshire nurses. To the 13 nursing colleagues we will recognize for excellence tonight, and especially my two colleagues from Dartmouth-Hitchcock, I would simply say, wow, what a meaningful recognition by your peers and by your profession to be honored tonight. I commend you for all this tremendous achievement. When I was invited to be your keynote speaker for tonight, naturally, I began to contemplate the many subjects around which I could organize my comments. I obviously could talk quite a bit about this surreal time we are all experiencing. By this, of course, I mean the COVID-19 pandemic. Since late last year, our entire world has been rocked by this pernicious virus. And though hope is on the horizon, we are not out of the woods yet. The foundational and essential frontline role that nurses have played in this time of stress, fear, need, and loss cannot be overstated. Related to our role in treating people impacted by the pandemic, we could also talk tonight a while about the fact that once again this year, making it 18 years in a row, nursing has been named the #1 most trusted profession in the United States. When the people of our country are stressed, afraid, need care and comfort, they turn to nurses, and we answer that call. It is no wonder that 2020 was designated the Year of the Nurse by the World Health Organization and the American Nurses Association. I did consider taking this opportunity to call out some of the deep divisions in our country concerning diversity, inclusion, belonging, and equity, and highlight the many ways that nurses step into this breach, providing nursing care that respects the dignity and worth of all people as they tend to the physical, psychosocial, emotional, cultural, and spiritual needs. Indeed, there are many issues and challenges facing our country and our profession that we could explore this evening. But after reflecting on these choices, I believe it is important to focus instead on the theme of the awards that will be handed out this evening: excellence. In preparing for tonight, I noted that there are 13 specialties of nursing in which excellence is being recognized. Of course, we know that this is but a sample of the specialties now recognized by professional nursing. When I did a quick search, some sources indicated that, like our colleagues in medicine, there are now over 100 specialties recognized in nursing. 100 plus. My, how times have changed. Years ago, when I took my licensing exam, we were tested in 5 separate areas: medical nursing, surgical nursing, psychiatric, obstetrical, and pediatric nursing. This is also how we were hired into our first jobs. It is sometimes hard to fathom that our practice has become so specialized in this short time, but as any one of tonight's awardees could attest, it certainly has. But here was the question this specialization issue prompted for me. Does excellence in one specialty look different than excellence in another? Let's take a few minutes and explore this question. What exactly constitutes excellence? A quick scan of the dictionary tells us that excellence means greatness, the very best, and that excellence is hard to achieve. Excellence is a quality that people greatly appreciate because it is rare. Given this definition, I'm thinking that despite the clinical specialization represented in the awards tonight, this concept of excellence may actually overarch or underpin each. It is something that is actually common across the specialties. In my mind, this overarching concept of excellence in nursing practice likely has the following 5 elements. Element of excellence number 1, patient and family centricity. This means that nurses who achieve excellence hold their relationship with their patients, families, clients, students, and the others they serve as primary. This relationship is always at the core of what they do. This relationship is their true north, their lodestar. It is this relationship that brings them to work every day. Element of excellence number 2, a deep and evidence-informed base of knowledge and skill to inform their practice. As I mentioned, this knowledge and skill may have differences across the specialties, but it is the depth and breadth of this knowledge that is the contributor to excellence. Nurses noted for excellence are those who are often situated at the top of the novice to expert pyramid, usually having worked for years to cultivate this knowledge and skill. They know how to use their knowledge and skill to deliver safe, timely, effective, efficient, equitable, patient-centered, and reliable care. Certainly, excellence means that one is an avid intaker of data and information from multiple sources and can translate it into usable knowledge, particularly knowledge that improves care and advances understanding. Element of excellence number 3, finely tuned interpersonal and teamwork skills. This means that nurses who achieve excellence are expert communicators. For their patients and families, they communicate in ways that can be comprehended. With their colleagues, they communicate respectfully and in ways that invite dialogue. They understand their role and contribution to the healthcare team, and they help others to understand theirs through guidance and support. Element of excellence number 4, an appreciation for the responsibility to not only be a lifelong learner, but to grow, develop, and nurture the next generation of nurses and caregivers, those that will follow in our footsteps. This is the willingness to teach, to share information, and yes, to learn from this next generation of nurses the things they know and understand, things which can elevate the practice of our generation. Element of excellence number 5. This is the catch-all element of nursing excellence. These are the attributes, the behaviors, the virtues of our profession. Altruism, veracity, fidelity, patience, caring, and yes, love. To these I would add passion, drive, resilience, and humor. I would submit to you that it is insufficient to earn the designation of excellence with anything less than all 5 of these elements. Excellence in nursing is a select all that apply test, and in this case, the right answer is all of the above. Thus, while there are clearly differences that allow us to categorize tonight's awardees into 13 awards for different clinical specialties, I would offer to you that these elements of excellence are very likely common to each of them. To tonight's award recipients, I would offer a few closing thoughts. First, appreciate that the praise and acknowledgement of one's peers is perhaps the highest form of professional recognition. Peer review is the most rigorous form of evaluation, and you have been identified by your peers as being excellent. As I noted earlier, excellence is a quality that people greatly appreciate because it is so hard to find. You are valued by your peers. Second, you are now officially a role model for other nurses. Recognize this as fact. Whether you view yourself as a role model for others or not, trust me, now you are. Others will aspire to be like you. This is at once a gift and a burden, but please accept it. As the lyrics from the Tim McGraw song, Humble and Kind, remind us, when you get where you're going, don't forget, turn back around and help the next one in line. Finally, don't forget to savor the moment. Take time, even a few minutes, to reflect on your career and what this award means. It means you have reached a peak, mind you, not the only peak, along a journey. This journey is not always fun and it's not always easy. This journey requires commitment and continuous investment. It is also a journey that you are called to be on. Tonight, we, your nursing peers from your organizations, nurses across the state of New Hampshire Magazine, and New Hampshire Nursing Association celebrate you and offer you the very best along the next leg of your journey. Best wishes to all of you, congratulations, and Godspeed. Thank you.